how can we be a part of transformation within this system of medical gaslighting?
Well, I think, there's a twofold answer to that, right? I think you, the patient, we, the patient, if you put me back in the patient chair, you have to be your own advocate, at least for right now. We are not in an age of medicine that was conversational and that was investigative, right? We're very much in an age of protocol medicine, you know, not to throw the word around, but evidence based medicine, which I think actually does some disservice to the individual patient in the long run.
Yep.
So we're in that age of medicine. So in that context, you, the patient, have to be super educated about yourself. You have to be able to articulate very clearly that you're not just feeling a certain way, but there are concrete symptoms that you are having that are a change from what your normal is. That's the first place to begin, because then the doctor will hear that no matter who the doctor will have. If you go in saying, I normally I normally sleep 8 hours a night, wake up feeling refreshed, but now I'm having to sleep 12 and I'm still tired. That is a concrete, tangible, tactical change, right? Or I've gained 20 pounds in 1 month. That is a very concrete change. But when you go in saying, I don't feel good or something's not right, for the typical doctor, that's very vague, and it's very easy to dismiss. I think, secondly, using tools like the hormone symptom checklist, like having a list of your very specific questions, having a list of labs you want to check, which is a part of why I wrote this, and having that conversation with the provider. I'd like to get these checked. I am suspicious about X, Y, or Z. I think that's another thing you can do. Now, that conversation is going to go one of two ways. It's going to be like, great, let's jump in. Here's what I think. I'm not sure I'm on board with this 100%, but hey, this is a collaborative relationship, so we're going to do this. Or it's going to be, hey, this is a waste of time. You don't need to do any of this. This who is this? Like all those doubting type questions. You may need to find another provider if you are not getting a collaborative and cooperative relationship, because medicine at the end of the day is a relationship. And we have results when we can work together. I've learned so much from the thousands of patients that have come through here, right? And if I didn't have that relationship with them, like my knowledge would also be very stuck. So I think that's what patients need to do. I think the other part is for people like me and maybe even you, we change our community, and I sort of, set that as a task that I need to start working on a little bit harder and get out there and educate and talk about this and talk about how things are interconnected. And if we can influence two doctors, they're going to influence two more, and it's going to spread. Just as we've seen the field of integrative medicine spread, functional medicine spread, this will spread too, but we just got to get out there and talk to our people.
We do have to get out there and spread the word. And, because of women like you, and I also think of Dr. Sarah Gottfried, and I think of Anna Kabecka as being just leading voices of saying we need to speak about women's health fundamentally differently than we have been in the past.